but the long-term complications, people can go blind, have heart attacks, can lose limbs.
These patients may be considered to be suitable candidates for surgical intervention.
I was afraid because it meant, because at that time, food was probably the only thing that made me happy.
It takes a very special and brave person to want to institute change, to transform their life altogether from one that is obese to not only looking better but feeling better. Now here at KPJ Damansara Specialist Hospital, their team of health practitioners at the Advanced Laparoscopic and Obesity Surgical Center will help you do that.
Severe obesity can be treated, so stop making excuses and start taking action. That's exactly what Nur Hafiza did in 2009. She decided to combat obesity and opted for bariatric surgery.
I was afraid because it meant, because at that time, food was probably the only thing that made me happy. So being taken away from something that gives you a lot of comfort, that needs a lot of preparation, and there are a lot of things that you have to change immediately, your eating habits, immediately post-surgery.
Through the years, her biggest challenge is also to keep the weight off.
It is difficult. You have to put a lot of effort in it because it's nothing magical in the surgery. It brings the weight down initially, yes, but to maintain the weight for years to come, for the rest of your life, you have to be disciplined.
According to the World Health Organization, more than 1.5 billion people in the world are overweight. Leading the way is Malaysia, with an obesity rate of more than 45%, the highest in Asia.
The cost of obesity and illnesses associated with obesity and the cost of diabetes, not only the medications, but the long-term complications, people can go blind, have heart attacks, can lose limbs. These are things which have to be stopped.
In Asia, anyone with a BMI of more than 28 is considered obese. Bariatric surgery is recommended for cases with BMI more than 38 or more than 28 with diabetes. They include invasive procedures like gastric sleeve surgery, gastric bypass and mini gastric bypass. Less invasive procedure includes the gastric balloon.
What we aim with this balloon is the fact that this balloon is there within the stomach. It will restrict the amount of food that the patient can actually take in, and it will theoretically give the patient a sensation of being full most of the time. Yeah.
So after the surgery, the patient gets weight reduction, so that they can be free from such kind of obesity-related disorders.
Complications of obesity include diabetes, high blood pressure, sleep apnea and joint problems.
80% of the people with diabetes and obesity, their sugar normalized, diabetes gone. But there are about 20% of them, those who are really, diabetes really bad, they have become better. They take less medicine. In the management of obesity, it is not only surgery. Surgery can be done by any experienced laparoscopic surgeon, but it is a teamwork.
A multidisciplinary, complete weight management approach which begins from the time a patient is screened prior to surgery right through to post-surgery.
Before feeling full.
They go on to be referred to first of all, the chest physician, the surgeons obviously will have to see them, the psychologist, the dietitian, as well as the physiotherapist. Yeah? So all this risk will be assessed and will be discussed, and actions will be taken to minimize the risk in view of these patients to have surgery later on.
Even the anesthetist is a special someone who's been assigned to the team.
To get
venous access, that is to put a line to give medications, sometimes not very easy because they are fat. So we identify that before surgery.
Post-surgery, the patient's hand is held to ensure an easier ride. This includes advice on diet and exercise, even post-surgery psychiatric help. Not everyone can handle a new me, a slimmer me.
For depression, there are a number of cases whereby they are already depressed, then maybe that depression has led to the problem also to the weight. So that's why we need to also look at that. But it doesn't mean that with depression they cannot go for surgery. They can. For mild depression, while they go for surgery, we also treat for the depression.
Most of the patients after surgery, they cannot eat rice. They don't tolerate well on rice. They can eat other types of carbohydrate like bread, biscuit, but then rice is usually a problem for them. We'll start with protein. Then later on, about 3-4 weeks later, they will start on fruits. Then after that, vegetables. Then lastly is those starchy food.
Patients after bariatric surgery, usually they will have difficulty in breathing. They will have shortness of breath upon exertion, and they will have the fear to move. Rehab is important actually to encourage early mobilization to minimize any complications after the surgery.
Despite the challenges, the team at the Advanced Laparoscopy and Obesity Surgical Center of KPJ Damansara Specialist Hospital say they've had a 90% success rate in patients keeping the weight off.